Thank you very much, Fabrizio, for the introduction. It's a pleasure to be here. I'm sorry that I do not speak your wonderful language, although I like to hear it, but I do not really understand a lot of the words. After you heard a lot about the structure of the society, about topics we are dealing with, the educational process, the scientific process with think tanks and so on, I would like to introduce you to an example of the relevance of sleep medicine, which might give a few insight, a small insight into the work of sleep physicians and the importance of the disease and the field. And I would like to guide you a little bit to our actual situation with COVID-19, with the pandemic, and how it relates at least to one field of sleep medicine. There are many connections between COVID-19 on the one hand and sleep disorders on the others. Maybe you heard about long COVID as a disease which affects patients after their disease, after their COVID disease. They not fully recover, both in pulmonary discomfort on the one hand, but also with fatigue, with sleepiness, unrefreshed sleep, and so on. So there are many connections between COVID-19 and sleep medicine. And I would like to focus on the relation between COVID-19 and obstructive sleep apnea. Obstructive sleep apnea is an important disorder, and I would like to give you only a short impression. This is a patient or a person which I had to give my medical expert opinion on. He drove the car, which you see here on the after this accident, and he fell asleep at the wheel. Unfortunately, there was a motorcyclist, cyclist, and he was hit and died immediately at the case of the accident. It was very dramatic for me to sit in the court because the victim had a 9-year-old girl, which was also in the court, and the driver had also a 9-year-old girl. And both of these persons, the victim and the persons who drove the car, both children do not have a father anymore, because the one died and the other is now in jail because of falling asleep at the wheel and producing this deadly accident. What does obstructive sleep apnea mean? It's a disturbance of respiration during sleep. It is associated with an occlusion of the upper airways. So the part behind the tongue is occluded because the muscles relax during sleep. And when, due to obesity or other reasons, there is a narrowing of the upper airways, they will occlude when the muscle relaxation during sleep happens. This is associated with different symptoms. 50% of the patients have the very typical symptoms, which you may have heard already or reported about already, which is snoring, witnessed apneas, daytime sleepiness. However, the other half of the patients does suffer from different symptoms or minimal symptoms. However, obstructive sleep apnea is important, not only because of daytime sleepiness, not only because of such dramatic situations like the accidents. It is also important because it's one of the most important risk factors for heart, brain, and vessels. It is associated with a severe reduction of the quality of life. It impairs daytime performance at workplace, in school, and in your personal living. Obstructive sleep apnea affects 9% of the female and 13% of the male population from the birth to the death. So a very high proportion of the population suffers of this disease. Although obstructive sleep apnea has such a huge importance, it has been forgotten, almost forgotten, during the pandemic. The patients didn't forget it, of course. The general practitioners also didn't forget it, but the society, the politics, really did not focus on this topic anymore. As you can see here, the services of sleep medicine have been reduced massively during the pandemic. So sleep services, physicians, nurses, and sleep labs have been reduced by 60 to 80% during the pandemic. That means our society does not focus really on sleep whenever there is another problem. It is an important and growing problem of the society. As I mentioned before, obesity is one of the most important risk factor for breathing disturbances during sleep. We know that obesity is one of the growing challenges for healthcare systems all over the world. Here you can see the portion of the population, the general population in different countries of Europe, which exceeds the body mass index of 25, which defines overweight and obesity. And you can see that there are almost no countries with less than 50% and up to 70% of the population being overweight or obese, and giving a high risk of breathing disturbances during sleep. As I mentioned, there are close correlations between obesity, sleep apnea, and COVID-19. And you may have heard that obesity is one of the most important risk factors for poor outcome in patients with COVID-19. Here you can see that the risk of being admitted to intensive care wards is increased twofold, and the risk of mechanical ventilation is increased threefold in obese patients. So if you are obese, you have a higher risk to be transferred to intensive care. You have a higher risk of invasive ventilation, and actually also have a higher risk of death. I'm sure you are aware that age is an important risk factor for a poor outcome in COVID-19 also. But in the younger population, those below 60 years of age, obesity is the most important risk factor. So we have a correlation between the risk factors. Obesity is a risk factor for poor outcome in COVID-19, and obesity is the most important risk factor for sleep apnea. So the relation between COVID-19 and obstructive sleep apnea and obesity are described in this cartoon. Obesity is associated with systemic effects. It's not just a mechanical aspect. Actually, it is a systemic effect. That means it involves the whole body, and it leads to an inflammation of the whole body. So obesity is an inflammatory disease. Obesity has socioeconomic factors. It reduces physical activity. It leads to reduced efficacy at the working place. And it also is associated, as you see on the right side of the figure, with mechanical factors on the lungs, on the stomach, and also on obstructive sleep apnea. All these factors contribute to a higher vulnerability to COVID-19. You get it easier. And if you get it, you are more likely to have a severe course and a higher mortality rate. There are only a few data focusing on the prevalence of COVID-19, of sleep apnea in COVID-19 and COVID-19 in sleep apnea patients. What we can say from the limited data is that about 20 to 30% of the patients with COVID-19 also suffer from sleep apnea, which is much higher than in the general population. And these facts can be combined based on the scientific literature in some aspects. First, obstructive sleep apnea and COVID-19 are both inflammatory disease. It's not only mechanics, it's not only obesity. Obesity leads to an inflammation of the body. Sleep apnea is an inflammatory disease. Second, as you may have heard, the virus, the SARS-CoV-2 virus, has receptors which adapt to certain characteristics of cells, the so-called angiotensin converting enzyme. So they adopt to these markers. And in sleep apnea patients and in obesity patients, they have more of these receptors. So the virus likes these receptors, and obese patients have more of these receptors. Third, the complications of COVID-19 often focus on the heart. So myocarditis, infarction, heart failure, and arrhythmias. And again, sleep apnea is also a disease leading to cardiac consequences. And finally, hypoxia and altered hemodynamics are typical for sleep apnea. They can induce coagulation, leading to thrombosis, emboli, and this also increases the risk and the risk of COVID-19 leading to thrombosis and emboli. And you may have heard about the discussion about the AstraZeneca vaccine, which might be associated with thrombosis. Actually, the disease itself is associated with thrombosis. I do not really believe that it's a vaccine. I come to the end, and what we have to discuss is, on the one hand, sleep apnea and COVID-19 are closely related to each other. If you suffer from one or the other disease, you have an increased mortality, you have an increased risk of cardiovascular consequences. Second, obesity, sleep apnea is something which impairs quality of life. However, during the pandemic, the sleep medicine services have massively been reduced. So on the one hand, we have more need for good sleep health services in the pandemic. On the other hand, they have been reduced. Therefore, societies, scientific societies have considered how we can stuck with services, showed an approach of the societies to get access to make the patients get access to sleep services even during the pandemic. And this is an important point for the future. Thank you so much for your attention.